My name is Ben, physical therapist here at Total Physical Therapy, and today we're going to be answering the question, does core training improve balance in older adults? To help us answer the question, we're going to be going over a new systematic review and meta-analysis that was released this year. We're going to be going over what they found, why it matters, and what it means for either you or your loved ones. Before we go over the review and what it has to tell us, let's briefly talk about balance and why this matters. Over the age of 60, there are a few things that will naturally decline as we age. Our muscle strength, our reaction time, our proprioception, which is basically our body awareness, and our spinal stiffness and segmental control. And these combination of factors lead to an ability of balance and lead to an inability to be able to control our center of mass inside our base of support. Simply defined, base of support is basically the area under the ground where your feet are encompassing. So I have a wider base of support with my feet apart, and I have a more narrow base of support with my feet together. My center of mass can be defined as the average of my mass, basically represented by a dot on the ground. If my weight or that dot on the ground stays inside that shape that we create with our feet, we keep our balance. If that center of mass or that dot escapes outside of that shape that we have created with our feet, that is when we lose our balance. And balance is all about our ability to be able to control that. How does core training help us with this? Well, core training allows us to be able to have more control over what we do with our center of mass. And your core is not just simply your abs. Your core encompasses basically everything from your shoulders down to your hips, and all of these muscles help us be able to control activities such as walking, bending, lifting, reaching, turning, and all of these various activities that can lead to people losing their balance. So let's go over the review. The review was published in the Frontiers of Public Health, and they pulled together 11 different studies over multiple countries that involved about 442 different participants. They looked at people in the age group over 60 years old, and they looked at studies that did core training anywhere from about 4 weeks up to 18 weeks. And they had to at least measure one balance outcome. They analyzed different tests, such as dynamic balance tests. These are tests that look at us and our ability to be able to dynamically move about an environment, such as a timed up and go walk test. They also looked at static balance tests, things such as being able to stand on one foot and seeing how long you can hold that. So let's go over and review the findings of the study. The first thing that was significantly improved within these individuals in the study was within one of the outcome measures known as the functional reach test. The functional reach test is where you are standing in place and you are reaching forward as far as you can, and you are measuring the distance of how far you were able to reach forward. And this was significantly improved in the groups that were tested for their core training. And this makes sense because a lot of the muscles that we use to be able to reach forward involves our core muscles. And this is important because I hear a lot of people in the clinic that come to me and will tell me about instances when they fall. And I will ask them, how have you fallen? And they will describe to me situations in which either they are trying to reach for something out in front of them, or they are trying to pick something up off the ground, and by doing so, they end up falling forward as they're trying to reach forward. And so core training is one way that we can help combat this inability to keep our balance while we are trying to reach forward. The second thing that was improved was known as the gait test. The gait test is basically a test that looks at your ability to walk, how fast you can walk, and how stable you are when you're walking. Not only did they walk faster, but their gait looked a lot more stable. Basically, when we're walking, you look more stable if you're able to keep everything in line and you're able to hold your hips nice and steady. Whereas somebody who's unsteady, typically you'll see a lot of wobble, or they'll have their feet further apart because they are trying to compensate for some sort of weakness. So a stronger core essentially helps with step asymmetry and this lateral sway that we see when people are less stable when they're walking. The third finding that they found was that standing on one leg also improved. It improved by about 3.19 seconds. Now, 3 seconds may not sound like a lot, but for somebody who is 70 or 80 years old that is having trouble with their balance, in a lot of cases, I'll have people come into our clinic that are unable to stand on one foot for almost any length of time. If you were able to get them to where they're able to stand for about 3 seconds more than what they were doing, this is the difference from them being able to catch themselves when they're falling or ending up on the ground. The fourth thing that also improved was the timed up and go test. The timed up and go test is essentially where you start off in a seated position, you stand up, you walk about 3 meters or 10 feet, you walk around an object, you come back and sit down as quickly as you can. And the authors of the study caution about the findings of this part of the test because it did improve, but if you took out certain factors within the study of the test, it was either statistically significant or it was not statistically significant. And this makes a little bit of sense because within this test, whenever we're walking quickly and turning around and coming back, the core muscles do have a part to play with this, and so we should see some improvements within this test. But what also plays a part of it is also other things such as leg strength, ankle stability, things that they did not control for nor did they intend to have in their intervention groups. And so because of that, they decided to basically have caution on improvements in this test. But for the most part, people saw improvements in the timed up and go test. The fifth finding in this review was probably one of the more actionable findings in the review, and that was what duration of time is the most beneficial for improving somebody's balance. And this review found that sessions that lasted longer than 45 minutes were much more impactful, especially on dynamic balance, than anything that was less than about 45 minutes. And so if we're looking at trying to improve our balance, potentially going for longer sessions is more helpful. And there are a couple ways we can think about this. So if I am trying to learn a skill like piano, and I sit down at my piano and I spend about 5 minutes working on my skill of playing the piano, over a period of time, that will get better. It will get better because I'm spending time practicing and I'm working on some techniques and things that I need to improve that skill. The same thing could be true for balance. If I spend 5 minutes of time working on my balance every day, as time goes on, potentially my balance will get better. But if I'm looking to optimize my performance, I'm trying to make it as good as I possibly can be. This is especially important for people that are coming into physical therapy clinics. It is dire need that I need to make my balance better now because I am having trouble falling. I am falling multiple times per week and we need to make this change. Then working for longer periods of time, of greater than 45 minutes, is more impactful for improving your balance, especially dynamic balance. This is where a lot of people are finding their times falling. Let's briefly talk about how core training actually improves our balance. And there are 4 main ideas that core training improves that helps us with this. The first would be what we would call trunk stiffness. And trunk stiffness is important because as I'm doing an activity, my ability to create tension in the core muscles will help me be able to maintain that balance. The second would be what we call neuromuscular control. By doing core training, I am improving the control of the muscles within my spine, especially if I'm picking core training exercises that translate over to balance. The third thing that improves is what we call proprioception, which is similar to neuromuscular control, but it's building up my ability to be able to sense where my body is. So if I can put my hand up, I know my hand is up because I have this awareness or feeling my hand is up. If I put it down, I now have this awareness or feeling that it's down. And we have that awareness within our spine and trunk muscles as well. And that improves as we are doing core or strength training. And the last thing that it improves is it improves this it improves what we call force transfer between our upper body and our lower body. So for example, if I were to go to my trunk and I were to grab groceries, I have some weight in my hands. That weight is transferred up through my arms. It is transferred through the core and then down into the legs for me to be able to walk my groceries from my car into the house. If my core is weak and I am not able to handle that amount of force in my hands, so for example, if I grab 20 pounds on this side and 5 pounds on this side, that weight is pulling me over to one side. My core has to be able to handle that amount of discrepancy and tension between one side versus the other in order for me to maintain my balance as I'm carrying something into the house. And those are just a few examples of why core training matters with our balance. All right, so let's finish with what I recommend for balance training based on this study. For best results, we need to be doing sessions that are longer than 45 minutes. And again, we talked about that. The benefits of going beyond 45 minutes is because it helps us build neuromuscular control. It allows us to have more time practicing the skill of what we're trying to improve. So therefore, our balance will actually get better. So sessions of over 45 minutes practiced 2 or 3 times a week for core training specifically. I would say if you're doing balance drills that are not core training, those can be done more often, but if I'm doing specific core training exercises, something 2 or 3 times a week will be sufficient. Different exercises that can be included within a core training program would be anti-rotation exercises, rotation exercises, lateral stability exercises, or exercises that are helping you control sway side to side, as well as controlled spinal movement exercises. By working on these different various exercises, we are going to be helping our ability to be able to manage static positions such as standing on one leg or being able to move around in a dynamic fashion. When you pick exercises, a lot of times to make it easier, you would start with more static positions such as standing on one leg or standing with your feet together or various positions like that. And you can transition to more dynamic tasks. So for example, instead of standing on one leg, maybe I stand on one leg and then I transition to another leg and then I transition to another leg. And by doing that, I have to figure out how to move my center of mass to various base of supports, and I will improve as I practice that. Another way to progress would be going from supported positions. Say, for example, if I'm working on core training in a laying down position, it's a very safe place to start because I don't have to worry about falling because literally the bed has my back. And so I can start there, but then as I progress, I need to be progressing to unsupported positions. And by working towards unsupported positions, I'm actually adding in that balance or that neuromuscular control element that we're looking for to help improve our ability to be able to ambulate and walk around. If you are looking for direct guidance for either you or a loved one in helping them improve their balance and reduce their fall risk, it would be a good idea to get them signed up for physical therapy because we are trained to be able to learn about where they are right now and where they are in their balance journey and pick drills that are specifically designed to challenge them where they are right now so that it helps them improve their balance over time. I hope you guys found this video beneficial. I hope it was engaging for you. If you guys liked it, give us a thumbs up. If you guys have any comments or questions, leave those down in the comment section below. And if you guys have any ideas of future videos or topics that you want us to cover, please leave those down in the comment section below as well. And as always, I hope you guys have a great day.